viewers and listeners, and welcome to the COVID-19 update for today, Wednesday, November 10, 2021. I am Godfrey Brooms, and soon we will be learning whether or not persons are gravitating towards the Pfizer vaccine, since the Minister of Health, Dr. Frank Anthony, announced last Monday that the vaccine is available for everyone. Starting today's COVID update, can we begin with an update on which COVID-19 vaccines are available to the public?
Right now we have AstraZeneca, but we're using the AstraZeneca now to give those who would have received their first dose to get their second dose. We also have Sinopharm, so we're doing both first and second dose with the Sinopharm vaccine. We have Pfizer, so people can get Pfizer first and second dose. We also have Sputnik V. Now we are giving the second dose because there are lots of people who would have received the first dose and need the second dose. And we also have the Johnson & Johnson vaccine, which is a single dose. So all of these are currently available. I think by and large people are coming forward to get vaccinated. I've seen now the preference is to get Pfizer or Sinopharm, and those who would have received their first dose AstraZeneca, they're coming to get their second dose. And we still have a lot of people with the first dose Sputnik, and we see them also coming to get their second dose Sputnik. So I think by and large people are trying to get themselves in order to be fully vaccinated, which is a positive thing. We'll, however, like to see more uptake, and we want to see more people coming forward and do this quickly rather than have a delayed response as we are seeing right now. The group that we are worried about, where we've seen relatively low uptake, would be the 18 to 40 age group. That's something because the numbers are relatively low in that age group. And also, while we have made the vaccines available for 12 to 17, that age group, we have opened up to this age group giving the Pfizer vaccine. The uptake there has been relatively slow. Basically, a couple of weeks ago, we had what I termed as a Delta surge, meaning we are going to see more people getting infected. And because of the nature of that particular variant, transmissibility was higher. So we'd expected a lot more people getting sick. People got sick, people got hospitalized, people died. And that's because the dominant variant that was circulating was Delta. The variant that continues to circulate in is Delta, but I think because of our levels of vaccination, especially in Region 4, which has now one of the highest levels of vaccination, that we would have seen the cases being reduced. And we would have also seen, because if you have less cases, you would have less hospitalization and less deaths. Unfortunately, the people who are coming into the hospital now are predominantly people who are unvaccinated. So as of yesterday, we've had 388,444 persons who would have received a first dose of a COVID-19 vaccine. That's now 75.7% of the adult population, meaning 18 years and above. And we've had 255,650 persons who would have received the second dose. That's now 49.8% of our adult population. In terms of the 12 to 17 age group, we have 28,045 persons who would have received a first dose. That's 38.5% of that age cohort. And we've had 19,138 persons who would have received a second dose. That's 26.2% of that age cohort.
And that's it for the COVID-19 update today. For more information, you can visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy, or our social media platforms. Godfrey Brooms is saying goodbye for now.